My name is Sandy. I'm married and I have a son, and he goes to a Catholic school, so we enjoy, raising him in the faith. I work as an outpatient occupational therapy. I'm an assistant and in mainly orthopedic injuries. So this month being breast cancer awareness, so we just kind of wanted to spread the word on the importance of just yearly checkups. It's so important that we're catching things early as soon as possible, getting a great medical team, if there is ever something. So we just wanted to make sure that we spread the word that if you've never had a test, if you've never, had a mammogram, if you have even a family history and you're not the ages that they say, it's important that you get checked. So last year in 2018, I was having some pain at my right breast that, I'd never had before. I was having symptoms that I'd never had before. So I saw my doctor and she sent me to get a mammogram, and they found, they didn't find anything, so they just wanted to double check, so they did an ultrasound. So I had an ultrasound, and they did find a little spot on my right breast, and so they scheduled me for a MRI, and they did find something. So I had to go back and I had an MRI biopsy. So they did take out the tissue and they tested it, and it turns out that it was benign. It was nothing to worry about, and so they had me follow up in 6 months to make sure everything was going okay. So I went back 6 months later and they scheduled me for another mammogram, and I had that, and then the lady that was doing the test just kind of like, let's do another image, and then she was looking at it. She said, oh, well, let me, I'll be right back. I'm just gonna have the radiologist, take a look at this. And then she came back, and so whenever they had done the initial biopsy in the previous one, they put a little marker, and that way they can know where they're testing, where they're looking for. And so I just figured it was something that they were looking at. Well, whenever she came back, she told me, well, we found another spot, on your breast. Like, here's the marker, this is what we're looking at, everything looks fine, there's nothing changed there, but there's this little area that is now present that wasn't before. And they recommended that I go ahead and have a biopsy done. And so this one was not under MRI, this was just under imaging, kind of like a mammogram, and they just went in and you're just seated, and they do a biopsy right then and there. So meanwhile, all this is happening, I'm still working, and no one knows, because I'm just thinking, well, everything's going to be fine, just like the last one was, no big deal. And so they were going to send it off for testing, and they would let me know. So having my chart, so it sends you messages, and so I'd be working with patients, and in between patients I would get a little alert that I had a test, and so I would check and see, and I'm like, no, it's nothing, it's something, and so I keep checking and everything, and then I realized that I'm not having my faith in God that I was thinking, because here I am worrying about it each time, and I'm getting up in between patients, I'm kind of getting distracted because I want to know the results. And so once I decided I'm just going to let this go, it's all in God's hands, there's really nothing I can do about this now, one way or the other. So I really felt a sense of peace about that. My breast specialist called, and she said, okay, so you do have cancer. And I was like, wait, what? And so I was like, because I'd seen her already before, and I was like, wait, what? And so she said, yep, so we're just gonna have to go and take it out, and just like we have done before, test everything and see. And so I said, oh, okay, that's fine. And so she said, my assistant will call you, and we'll get you set up. And so at that moment I was just like, wait, what? Like I didn't quite believe it, or didn't understand, and we set up a meeting with the doctor, and then we were going to set up the surgery. So I'm part of the ACTS team at St. Luke's, and we had a ACTS retreat coming up within a couple weeks, and so we kind of pushed it back because I had already committed to that. And then we had my son's field day, and so I was like, well, okay, let's do it after that. And so in the meantime, I just went about my life. I was very much at peace with it. So then had the surgery, and whenever they do like little biopsies, they put like the marker. So this one had its own marker, and they go in, they remove it. So I took a day off of work, and they removed it, and they take an area around it, just to make sure that all the markers were clear. And so she said, we'll let you know in a week and everything should be fine. I go in, and my husband comes with me to the appointment, and they say, well, we removed the tumor, so it was a success, but when we removed it, there was another small tumor within that small piece of tissue that we took. Just it mimicked the other one that didn't show up on imaging. And so we needed to go back and have surgery again to then remove the new area and then have everything tested to see. So that was kind of surprising to me, because I was like, wait, I have cancer? And it's not like benign like the others. You don't just, pick up your life and go on about your day. It was, no, this is happening. This, and so, but she said again, there's no need to worry. Everything's fine. It was caught so quickly because of early diagnostics and having a mammogram before and then following up 6 months later. The concern was, well, these didn't show up in imaging, so is there more?